Hey, everybody, this is Steve Adams from Tiger Medical Institute with our Chief Medical Officer and co-founder of Tiger Medical, Dr. Matthew McNamee. Hi, Dr. Matt.
Hey, Steve, how are you?
Good, good. Well, Doc, we've talked a lot about this topic. It's a complex one. It's fatigue because there's a fatigue that is addressable and there is a different fatigue that is complex. Called chronic fatigue syndrome. We're going to talk mainly about the kind of fatigue that you work with every day and get good results on. And then at the end of this video, what I'd like you to do is try to address this whole notion of what is chronic fatigue syndrome. Does that sound okay, Doc?
Yeah, no problem. You got it.
All right. So talk to us about generalized fatigue, the kind that you see in our practice consistently. About like, what is that? And then maybe some of the common sources of it that you see in your experience.
Sure, no problem. Yeah, so the generalized fatigue that I see, most commonly would be, fatigue that is, either commonly and the individuals have it at certain times of the day. It could be the afternoon, it could be surrounding meals, after meals, skipping meals. If it's commonly all day long, there's some other common causes of that. Things like we rule out like anemia or thyroid disorders associated with that. Typically, it's sometimes it's improved by things like eating or rest or sleep, or stress management. So typically it either can wax and wane, or it's more like I said, if it's generalized, we can rule some of those things out. But and very commonly, like primary care providers will rule out the most common causes of fatigue through a lot of their standard blood tests. The things that I see real commonly are, related to hormone imbalances, either pertaining to like thyroid dysfunction or imbalances in the adrenal hormones. I see some lifestyle stuff. Sometimes it's as kind of straightforward as blood sugar imbalances, whether they're too high, or blood sugars are too high or they're too low. There could be some dietary stuff, whether it's just poor diet or it's nutrient deficiencies. I see stuff very commonly as simple as not getting enough sleep, especially with the people that I work with. They some of them work late, long days, late at night, and skimp on sleep, for reasons of like productivity. Like I said, stress can play a role. Just being, generally stressed can deplete, energy stores. Sometimes foods play a role. Sometimes individuals have food sensitivities that will translate to generalized fatigue. I see pretty commonly imbalances in the gut. So could be imbalances in the microbes. So you could have a tipped balance from the beneficial bacteria to the problematic, or could be potentially harmful bacteria, and there's an imbalance, and that can damage the lining of the gut. And then you can have components that are supposed to stay within the intestinal tract through digestion and everything, actually that get into the bloodstream, because there's a damaged protective layer there, and that creates all kinds of problems. It creates typically systemic inflammation, and that can translate as sometimes brain fog, fatigue. Some people get, changes in their mood, anxiety, depression, things like that. But And then, sometimes there's infections that we can pick up on, whether they're in their gut or elsewhere, if we address that can, impact energy. I mean, probably most people relate if they get, sick or something, that a lot of times the energy goes down. So sometimes it's not as evident, just like of an acute infection. It could be something a little bit more chronic in nature that we can rule out.
So
those are probably the most common things that I run into.
Okay, thank you. In your clinical process, like how do you attack that? So you get someone that's presenting generalized fatigue. What are the typical tests that you're running, and then how do you help them overcome this? Like, in what kind of a time frame does it usually take?
Sure. I mean, time frame is going to be different for every single thing that I guess what the cause is, right? So something as simple as iron deficiency anemia, and you replace the iron, and that you can turn the corner a lot quicker with something like that. If it's a thyroid disorder, that could take several months. Some of the adrenal stuff can take up to 9 months. Gut health, if it's anything related to the gut, that can take anywhere from 3 to 6 months. Nutrient, deficiencies, if we dial those in, you may start feeling better, within, several weeks, sometimes even sooner. If it's food sensitivities, roughly, I would say 3-4 weeks after pulling those, the main culprits out, individuals may start to feel better. I mean, they're all going to kind of vary depending on the cause. If it's just the duration of sleep, I mean, that can be, you can notice that. I'm sure anyone can experience that, right? The next day, right? You get quality sleep. If it's something like, obstructive sleep apnea, you got to really, depending on how you approach that, you'd have to, really get to the appropriate, therapy to address that, so that may take a little bit of time, but they're all going to vary depending on
Gotcha.
what the causes are.
Yep. Okay. Good.
Infections, especially, and some of them that we treat, some we refer out depending how, kind of complex they are. Those can vary, depending on how they respond to treatment. Gotcha.
Okay. Good. Well, so, that kind of, demonstrates how we deal with it. And if someone, is watching this and they know they have chronic fatigue syndrome, or there's that letter ME for it as well. We're not a good fit for that, are we, as a clinic? I mean, that they need to be addressed differently. What would you say about that? So for people that are desperately trying to find a solution for their diagnosed chronic fatigue syndrome.
Yeah. So, I mean, if someone has been diagnosed with that and they know that that's what, they're really what they're dealing with, it's can be a very complex condition to address and treat and to find the underlying causes of. Sometimes it's related to things like, tick-borne infections, things like Lyme and other the co-infections that go with it. Sometimes it's mold, mycotoxins. Sometimes it's, other, heavy metal toxins, things like that affect, ultimately their mitochondria, and it's other, there's other complexities and stuff involved with it. It's finding someone. I would suggest probably, a place to start is you can, go under the ifm.org, and you can search your vicinity. You put a mile radius on there, and you would look for, they have different categories where, they can specialize in. You could look for someone that literally specializes in this in your area. That's probably a place that I would start. It's probably, if that's the place I would go to.
Okay. Well, good. Well, Dr. Matt, thank you again. You're a wealth of information for our viewers, and appreciate you being on today.
You bet. Thanks, Steve.